Tonight with two big investigations.
Dave Savini's been digging into growing concerns at a Southwest suburban nursing and rehab center where the daughter of a patient says lives are at risk. He joins us live. Dave.
Erica, we're told public health investigators are now looking into the outbreak here at this nursing home in Bridgeview. This comes after a week-long CBS investigation here and a daughter's fight for her mom.
Happy birthday to you.
Her name is Visitation Barnaby. And look at that smile as this retired healthcare worker gets the full birthday treatment, along with cheesecake at one of her favorite restaurants last year. A few months later, she broke a hip and needed medical care, and ultimately ended up at this Bridgeview nursing and rehab facility, the Bridgeview Health Care Center, which has seen an explosion in COVID-19, 31 positive cases, and 11 deaths.
Your mother was in that facility for how many days?
Apparently, approximately 100 days.
And there was a COVID outbreak there.
A COVID outbreak.
Julie Berkowitz says her mom's stay here has been frightening for them both. After the facility went on lockdown in March, Julie says she could hardly get any information about her mom. Sure, she says the facility posted this video of crews cleaning the place on its website, but she says she didn't get contacted about the deaths and says she first heard about residents dying here from the news media.
This is my mother. I would like to know what is going on there. There's no communication.
Julie says there were no landline phones in her mother's room, and it would take 5 to 6 days to get staff to call her back when she checked on her.
We are failing our most vulnerable population.
She says another problem is the handling of so-called isolation rooms here. With numerous COVID-19 deaths being reported, her mother was supposed to be put in isolation here on the 3rd floor. But her mother told her at one point another resident was put in the same room with her that she'd never met before. How can you be in isolation if there's another person in the room with you?
That's a question I've asked them, and then they quit talking to me.
She also wants to know about testing procedures and who did or didn't get tested in the 100-plus bed facility, especially since 8 staff members also tested positive.
I believe everybody in that facility should be tested.
Then Tuesday of this week, Julie's mother was suddenly discharged. Julie's 84-year-old father was in the car to meet his wife of 60 years to take her home. It was then that Julie finally learned from the staff that her mother was never tested for COVID-19 despite the outbreak and was cleared to leave anyway.
You're saying that that home told you they did not test your mother for COVID-19 before they released her?
They told me that she had not been tested. How can you take my mother out of this facility and put her in the car with my father? You are putting my father's life at risk.
And now, because of that risk, she's ordering her own private tests on both of them.
Now, officials for this home won't say why they released that woman from this home without being tested. They did say they didn't get any tests from the state of Illinois until last week. They got 20 tests, and they say they basically used all of those on 18 more suspected COVID cases in their facility. Sadly, they are informing us now that 2 more residents have just died. That makes 13 residents here. That's more than half of the positive COVID patients that they've tested that have died here. Live in Bridgeview, Dave Savini, CBS 2 Investigators.
That's devastating numbers there, Dave. What is the county health department saying now that you've alerted them to the situation out there?
The health department tells us an investigator for them has communicated with this facility. They have educated them on how to obtain tests on their own, private tests. They're a private facility. They could buy their own tests. They also say that they're working on protocols and procedures for infectious disease control procedures here that apparently weren't in place. What those are, the new things that they're doing here, they're not saying.
All right. Dave Savini, investigator, live for us. Thank you.